everyone. My topic for today is adenoids. Before starting the topic, let's judge this girl by looking her face. Most of us will think she is dumb, but we know the proverb never judge a book by its cover. This is true in this case too. She is suffering from a condition. Let's study that condition. Now, when we divide the word adenoid into adin, which means gland, and oid, which means like, we get an idea that this condition looks somewhat like a gland. Let's see the definition of adenoids. When hypertrophied nasopharyngeal tonsil starts producing symptoms, the condition is known as adenoids. This hypertrophied tonsil looks large, like a gland, and hence the name. The etiology of adenoids are age. This condition is more common in children. The predisposing factors, which may be endogenous or exogenous. The endogenous factors, which include pre-existing URTI, tonsillitis, general lowering of resistance. The exogenous factors include ingestion of cold drinks or foods. The clinical features include nasal tube obstruction, nose pinch, high arch palate, voice is flat and toneless, and eustachian tube obstruction. The photo on the left shows normal palate, whereas the photo on the right shows high arch palate. Here, the above picture shows hypertrophied nasopharyngeal tonsil, which is not affecting the eustachian tube. And the below picture show, shows the enlarged adenoid, which blocks the eustachian tube and air passage, resulting in hearing loss and breathing through the mouth, respectively. The girl which we saw earlier is suffering from adenoids, and the typical appearance of a person suffering from adenoids, like the open mouth, pinched nose, etc., is known as adenoid faces. Now let's see the diagnosis. The condition is diagnosed on the basis of clinical features, radiological examination, which shows the adenoid mass and the constricted airway. Posterior rhinoscopy, palpation of the nasopharynx, but as it is an unpleasant procedure, it should be avoided. The differential diagnosis includes nasal obstruction may be due to other causes like rhinitis, deviated nasal septum, and benign tumor. Now let's see the scope of homeopathy. The scope of homeopathy is good if the mass is not too large. Our treatment can prevent the recurrence of infection after the surgical process. The remedies which may be used include Bariticab, Argentum nitricum, and Calcarea iode. Thank you.